Hi everyone, my name is Ibrahim Guindo and I will talk about clinical and genetic aspects of amyotrophic lateral sclerosis in Mali. Amyotrophic lateral sclerosis is a progressive neurodegenerative disease involving motor neurons and affects 2 to 5 under 100,000 individuals worldwide. About 5 to 10% of all cases have a family history of amyotrophic lateral sclerosis. Mutations in several genes are associated with familial and sporadic areas, mostly in Caucasian population. Little is known about the genetic contribution to ALS in Africa, especially in Mali. We aim to clinically characterize patients with ALS features and identify the underlying genetic defects. The study was approved by the ethics committee of the Faculty of Medicine and Dentistry. Informed consent was obtained before clinical examination. Patients were evaluated by neurologists. Blood chemistry including vitamin B12, nerve conduction studies, and brain and spinal MRI were performed. Candidate testing will be first performed before whole exome sequencing or whole genome sequencing in negative families. 16 families totaling 16 patients have been enrolled. No family story was reported. Clinical findings were sex ratio 1.6 in favor of men, mean age at diagnosis 34, physical signs were muscle weakness in upper and lower limbs, muscle atrophy mostly in distal upper limbs, breast tendon reflexes in lower limbs, bilateral sensory and plantar reflex, tongue fasciculation. This is a clinical case of 62 years old patient female seen for muscle weakness in forelimbs, hypotonia in upper limbs, and rigidity in lower limbs, breast tendon reflex, and extensor and plantar reflex. No sensory impairment. This is our patient from consanguinity relationships, and as you can see, she is the only affected in the family, suggesting a sporadic case. The next step is resume with patients and relatives enrollment, complex laboratory testing, spinal MRI, and nerve conduction studies are ongoing. To finish, I thank all people in our laboratory, especially Dr. Lanzuri.